Good evening. My name is Dr. Janice Brown. I've been practicing medicine for the last 17 years. I'm a graduate from the Fiji School of Medicine, and I currently work as a resident physician at Dr. Naidu's private practice in Nadi, Fiji. We are heavily involved in patient-centered holistic care and often involved in community-based projects. I'm affiliated to the Fiji Medical Association, Fiji College of General Practitioners, World Organization of Family Doctors, and the South Pacific Society for Lifestyle Medicine. My special interests are women and children's health, diabetology, and gastroenterology. During the second wave of the COVID-19 pandemic, Fiji's healthcare system has been overwhelmed and strained. We needed a new dimension of service to deliver healthcare to the people. Dr. Naidu's private medical practice introduced a professional level of telemedicine called Vuniwai Telemedicine. Telemedicine is basically the use of electronic communications using a software to monitor and treat patients at or from a remote location. It is also known as digital health. Telemedicine has been around since the mid-20th century, when radio was used to send medical information to ships. And then in the 1950s, it was used in hospitals to monitor psychiatric patients. Telemedicine was adapted by larger developed countries pre-COVID to remotely monitor patients in rural areas. This featured service is not new to developed countries. It existed but was not widely explored. This pandemic has brought it to center stage, and there is a global increase in user numbers and profits. These are some popular telemedicine companies in Australia: Instant Consult, GP2U, Doctoroo, iClinic, and Docto. Why telemedicine? There are many benefits of telemedicine. No transport cost, no time off work, no child or elder care issues, quick access to specialists or your own GP, less waiting room wait, more frequent consult, etc. But at present, it's the fear of contracting COVID-19 infection from visiting a medical facility. This is our product, Vuniwai Telemedicine. Telemedicine through an app on your phone or on your desktop through a website. Vuniwai Telemedicine is Fiji's first medical consultation app, which is also web-based. I will soon elaborate the features of Vuniwai. Other forms of telemedicine have been around previously: Viber, Skype, and messenger communications, phone calls, SMS, or emails. Vuniwai was first launched in Feb 2020 at Dr. Naidu's private medical practice in Nadi, then relaunched Fiji-wide in July 2021 in the height of the pandemic. We have had very good responses from Central, Western, and Northern Fiji. We have just over 4,000 registered users. We have done over 1,000 consults to date and counting. Vuniwai means doctor in the Fijian language. There's full-on text and video consults. The service has been free till date as a COVID special. You can download the app through Apple or Play Store. The future payment gateway is via Vodafone's M-Pesa. This is how the app appears on your screen. This is the startup. Then you log in. On your personal health record page, you have your health profile. This is where you upload your medical history. And you have your health journal. This is where you can write about your health. And then your health trackers, where you can upload your blood pressure, blood sugar, pulse, and exercise records. These are the details you can upload for you and your healthcare provider to see. Health conditions, all your illnesses to date, medications that you are on, allergies to food and medication, hospitalization history, consultation notes on this app every time you consult a provider, surgeries, treatments, and procedures, caregivers and emergency contacts, and vaccination records till date. There's also a health blog. This is the provider listing page, and there's just the two for now, myself and Dr. Chris Naidu. Dr. Chris Naidu is the founder and creator of Vuniwai Telemedicine. It was his idea to introduce this an innovative healthcare solution and new branch of medicine to Fiji on this platform. It was well in its planning phase way before COVID was a thing. He is a family physician and medical director of Dr. Naidu's private medical practice. Once you click on your provider, you will get more information. Briefly, this is how the web-based Vuniwai Telemedicine looks on your desktop. Very user-friendly, all the features as on the app, including educational marketing videos, patient testimonials, and links to YouTube, Instagram, and Facebook right at the bottom. When download is complete, follow through to create your personal or family account. Now you can start using Vuniwai Telemedicine. You can either book a video consult or proceed to a text consult. This is the text format on your page. Here you can upload pictures of anything you want to share. Reports, prescriptions, skin lesions, really anything relevant. This is Vuniwai Telemedicine notification on your phone. After Vuniwai consultations, these are your outcomes. You will get expert medical advice and recommendations, guidance for over-the-counter medications, referral to the nearest health facility or specialist if we assess the case to need face-to-face care. If needed, an e-prescription will be issued that can be shown to your pharmacist. The Fiji Pharmaceutical Society is aware and widely accepts e-prescriptions through Vuniwai. We have a medication list to follow and are very cautious with what can and cannot be prescribed. This is a sample e-prescription. It has all the features of a proper prescription: practice details, prescription time and date, provider name and e-signature, patient details, prescribed medicine details, medication, dosage, duration, and extra instructions, an edit section for pharmacists to put in their details. Some of the challenges we have faced so far: internet service quality. Poor internet makes video consults and downloading of uploaded pictures a great challenge. Smartphone and Windows limitations. You may have issues if your smartphone or Windows features are outdated. Patients' lack of technical skills. But we have a feature where you can ask a question or book a video consult on behalf of someone else. Patient examination challenges. We see patients face-to-face daily, and we have come to accept that this is not a hands-on style of consultation. Communication and detailed exchange of information is the key to using telemedicine on any platform. Privacy issues, especially by the users. Medical information is very confidential. This app has security features. The data is cloud-based and protected by HIPAA compliant Amazon Web Services. This one's from Mr. Rick Rickman. This is a dream medical practice, quite apart from the fact that minor complaints and problems can probably be diagnosed and treated via the internet. The professional manner and the efficiency with which my medical problem was resolved was excellent. I recommend this clinic and this app to people and families of all ages. Vinaka Dr. Janice Brown and Dr. Chris Naidu, you are the best. This is from Amenatave Tuilevuka. Thank you for your advice. I was able to get my first jab of AstraZeneca vaccine. This is from Shrutika Chand. Really liked this app. Able to get the solution without taking my child out to the doctor. Timing of the response took a bit of time, but I really appreciated that even at 9 p.m., Dr. Chris replied to my query, which really indicates how much they care for their patients. This is from Sanjeet Singh, and he says, highly recommend all to use Vuniwai app. I went through a really good and educational consultation with Dr. J. Brown. I didn't have to wait for the replies for long. It was fast and efficient. Helpful during these times. Thanks, Doc. And this is from Farzina Shah. The doctor was very responsive and answered my questions. He even advised me on what next step I should take. And this is from Kavinesh Shankar. I thank the doctors for the timely and informative directions and immediate remedies to ease health problems. Best so far in the market for health services I came across. A very thanks for the innovation. Regards. Now we will play some educational marketing videos.
Hey, what's up with your neck?
I don't know, I have this really bad neck ache.
Really?
Yeah, I think I'm gonna go to the doctor.
Have you tried the new Vuniwai app?
What's that?
Introducing Fiji's first medical consultation app, Vuniwai. Telemedicine, text and video consultation, expert doctors, e-prescriptions, free consultation for the first 500 users. Download the Vuniwai app today and pay via M-Paisa.
How's the baby? I think we need to see a doctor.
How about we use the Frontline app?
Good idea.
Repeat the syrup every 6 hours and she will be fine, okay?
During these challenging times, we bring the doctor to you. Video consult our doctors today.
Searching for the cause of your symptoms on the internet can be bad for your health.
What are the symptoms of migraine?
Brain tumor.
I've got a stomach cramp.
Hepatitis.
I got hearing problem.
Dementia.
No, I have a sore throat.
Bone marrow cancer.
I got a tingling and numbness in my wrist today.
Tanda bin Mari.
See, this morning because I still have some cramps in my leg.
Kani Kani.
Why search the internet when you can consult real doctors online? Download the Vuniwai app today.
We have future plans for Vuniwai telemedicine to get more providers on board so our patients can have a wider choice. We want to cover more specialties, nursing services, mental health services, etc. This app can be maximized by adding on medical monitoring gadgets that will give us real-time information such as pulse rates and oxygen saturation, blood pressures, etc. We hope to get more collaboration with stakeholders to provide telemedicine services to a wider audience. And that's about it from Vuniwai Telemedicine. We would like to thank Friends for Fiji and Nate for giving us this opportunity to present at your annual education night. All the best for the rest of the program. Vinaka.